So good morning everyone. I'm Dr. Virendra and I'm here to present my paper on incidence of eye diseases in rural and tribal population in Narsipatnam during district residency program. There is no financial interest in this study. Access to quality healthcare is a fundamental right, yet many rural communities face significant challenges in obtaining necessary medical services. Among the crucial healthcare services often overlooked in rural and tribal areas are the eye examination and the early detection of eye diseases. India rural population for 2021 was 96.8 crores and tribal people constitute 8.6% of the India's population, which is about 10.4 crores. Rural communities often encounter unique challenges when it comes to eye examination and eye disease management. Some of the key obstacles include limited availability of eye care facilities, distance and transportation, and socio-economic factors. My objective is to shed light to ascertain the importance of eye examination and incidence of eye diseases in rural and tribal areas in Narsipatnam during district residency program, and to explore the screening methods and to create awareness for periodical eye examination, to categorize the subject based on various ocular diseases. This is a hospital-based analytical observational study conducted in 154 patients for a period of 3 months, which is from March 2023 to May 2023 in Area Hospital, Narsipatnam. All the subjects underwent comprehensive ophthalmic examination where visual acuity, automated refraction, subjective verification were done, intraocular pressure was recorded by applanation tonometry, anterior segment and detailed fundus examination were done with slit lamp and 78D lens. All the patients attending the ophthalmology OPD in Area Hospital, Narsipatnam were included in this study. Patients under the age of 7 years of age were excluded and patients who did not give consent were excluded from this study. Results among the population of 154 which have taken in my sample, there are more amount of rural population which accounted for 74.02%. And this is the age distribution chart showing majority were in the age group more than 45 years, which is 51.94%, followed by 21 to 45 years age group, which is 33.11%. This is the sex distribution showing more amount of males in this study, which is 51.94%. And this is the frequency of ocular diseases in which the cataracts, lenticular diseases were the most frequented ocular disease, which is 34.41%, followed by refractive errors, which is 26.62%, followed by conjunctival diseases, retinal diseases, glaucoma, corneal diseases, and adnexal pathology. In our study, the most frequented ocular disease is the cataracts, which is 34.41%. The following studies also have cataract as the most frequent ocular disease. The Pooja HV et al. Conducted a hospital-based cross-sectional study from July 2018 to June 2019 in patients more than 40 to 80 years amongst 2,912 subjects, in which males were more in the study and the cataract was most frequent disease. According to the APEDS, which is Andhra Pradesh Eye Disease Study, which was a population-based study conducted to determine the prevalence and causes of blindness and visual impairment in 11,786 subjects by multi-stage sampling belonging to urban, rural and tribal population in Andhra Pradesh, cataract and refractive error were responsible for 60.3% of blindness and 85.7% of moderate visual impairment. Praveen Vashist et al. Conducted a population-based study in 2022 in persons aged 50 years above and concluded that cataract was the most common. Few studies showed other ocular disease as more frequent in the population, such as Anupama Kumar et al. Conducted a community-based cross-sectional study in 2016 in 812 subjects. Among them, the males constitute 51.4% and myopia was more common, followed by cataract. V.K. Schrodt et al. Also conducted a community-based cross-sectional study in 2005 in 925 subjects and concluded myopia was more common, followed by conjunctival xerosis, hypermetropia, pterygium and cataract. To conclude, as the specialist medical services are scanty in rural and tribal areas in India, there is a need to conduct more screening and awareness camp to combat the avoidable blindness. By emphasis on education, we can bridge the gap and improve the eye health outcome for rural communities, enabling a brighter future for their residents. This can be done with trained paramedical assistants, and by teleophthalmic services, we can make significant progress in ensuring equitable eye care services for all. Campaigns for public awareness regarding surgical correction for cataract and correction for refractive errors should be strengthened. These are my references. Thank you.
You have not mentioned about corneal infections or corneal problems.
I have grouped under corneal diseases, ma'am, those all.
So what is the incidence of corneal diseases? At rural level, how are you managing the corneal infections?
If there are any ulcers, we are giving the antibiotic for bacterial ulcers and fungal ulcers. Natamycin is available there, ma'am, antifungals. If the ulcer has perforated, or we are referring to the higher centers, ma'am.
After perforation, you are
Not
referring.
only after perforation, ma'am. If the ulcer is not healing also, we are sending it to higher centers.
How will you prevent perforation of corneal ulcer?
So we prescribe them antibiotics for any. We prescribe them the antifungals and antibiotics, and we prevent.
When you said cataract, did you consider all the cataracts, or was there any cutoff line like
No,
6/9 or 6/12?
Not based on the visual acuity, sir. Immature, mature, everything we have taken in the cataract section, sir.
So you have gone to Narsipatnam, which is
Yes,
a rural place. What is the cataract surgical rate over there?
Per week, they are doing 10 surgeries there.
What are the types of cataracts there? Mature cataracts or immature cataracts?
Mature cataracts and hypermature and immature senile cataracts.
Why still mature and hypermature? Is there no awareness in the public?
There, ma'am.
Why still mature and hypermature cataracts are there? Is there no awareness among the people?
Yes, ma'am. There's lack of awareness, and they don't want surgery. They just need eye drops or any spectacle correction for that.
So many area hospitals are there now. So we have to increase the awareness.
Yes, ma'am.
And regarding corneal blindness also,
Yes,
we have to educate them. They should not use own medications.
Yes, ma'am.
Okay?
Okay. Thank you.